Good morning, good afternoon, good evening, depending on where you're watching me from. Please, we are hearing from Ng.O. It has been a while I posted. So today, actually, I want to discuss this disease called cholesterol. Sometimes we ignore this disease. I don't call it, no, it's not a disease because there are good cholesterol and there is bad ones. The good cholesterol is stored in the liver and body make use of it when there is need for that. But when it is no longer in the liver, maybe when it is now found in the arteries, in the bloodstream, that is those ones are the one we called bad cholesterol. I want us to discuss this bad one, the bad cholesterol, because sometimes for me I call this bad cholesterol, this one, innocent killer disease. Do you know why I call it innocent killer disease? Actually they kill, but they put the blame on another sickness without knowing that it's this bad cholesterol that kills. That is why personally I call it innocent killer disease. Sometimes when this bad cholesterol kills, they will put the blame. Maybe they will say, hey, so you remember that man there, he just slumped and died. Okay, that man used to have high BP. He's on drugs. He even have diabetes. He's on diabetes. He's a diabetic patient. He's always on drugs. He's a diabetic and a hypertensive patient, without knowing that what exactly made that man to slump and die is cholesterol. So that is why people even in the lab, you hardly see people go for this cholesterol test. In lab, we call it lipid profile test. Lipid profile test. In that lipid profile test, you do LDL. LDL is called lower density lipoprotein. They are the one that is called bad, the one that is causing problem. That they are the ones you find in blood vessels in the arteries. They are the one that causes heart disease. They are the one that contributes to cardiovascular disease, all this atherosclerosis. In that cholesterol test, that lipid profile test, you do HDL, high density lipoprotein. You do LDL, low density lipoprotein, and you do this one again, triglycerides. When you do these three things together, collectively they are called lipid profile test. I don't know why people keep doing it. I don't know whether because the test is a little bit expensive, unlike when you compare it with sugar test, when everybody used to carry their glucometer around, they can easily do their sugar test now, or carry their BP machine here and there. They can easily do their BP. But in this cholesterol lipid profile test, it's a little bit advanced because it is normally done in the lab. It is after doing it and your result is being issued to you, you can take it to your doctor to interpret it for you. In that result, you will see LDL, low density lipoprotein, that is the bad one. Then we have the good one, high density HDL, high density lipoprotein. You can find those ones in the liver. Body can go there and make use of it when there is, because they can use to produce certain hormones in our body. They can be even used to produce some cells. Even that I had, you can even use, they use for in the production of vitamin D as well. You see, so is cholesterol is in the body, but when it is in excess, it is when we call it bad cholesterol. So you need to do the test and check. Also mind what you eat to put it in check. If you produce more of it, it will go to the blood arteries and cause clots. It will make blood finding it difficult to pass through the arteries, and thereby pumping of blood will be making it very difficult. So what I'm trying to let us know is this: we do ignore this cholesterol, but it's not good. It is not good. You still need to check it the way we are checking sugar test. You understand? You still need to check it the way you are checking your BP test once in a while, especially if you are diabetic or hypertensive. Is even when you need this test more. Don't ignore it, because it's this cholesterol that they kill more than those diabetes and hypertension. Now let me tell you what you experience in your body, then you will know that there is need for you to check for this bad cholesterol. If you are experiencing shortness of breath, maybe sometimes you may be talking, it will be as if something take away the speech out of your mind. You feel loss of control of yourself. Shortness of breath, tightness of chest. Don't ignore all these things I've mentioned. I'm not saying that they are the symptoms of cholesterol, but they can be another thing. But it's good to check for this cholesterol as well when you are feeling all these things I'm mentioning to you now. When you are having high pulse, when you have high blood pressure, when you are having sugar in your blood and weakness in the body, maybe you are doing something, maybe you are jogging, you are running, all of a sudden you are as if you are losing it. You cannot hold your breath anymore. You need to check for this cholesterol. And also, if you are having this severe headache, every time you are complaining, every headache is not typhoid though. Yes, every headache is not typhoid. So don't ignore them. Please, you still need to check. Even if it is once in a year. You think everything is sugar, hypertension, sugar. Please, let us not ignore this cholesterol. There are things we eat that can introduce bad cholesterol in your body. Things like all this junk food, trans fat food, butter, margarine, coconut oil, even they say palm oil itself. I'm even still making research on that, because I thought palm oil is a natural oil, but I don't know why it is included. But anyway, still make your own research. I'm not here to teach you everything about a particular ailment. What I want you to know is the vital things you need to know about. Because if I start teaching you all you need to know about this thing, the whole of today will not even do for it. So these are the vital things you need to know about cholesterol. Please, after watching this video, if you know that you are above 35 years, please try and do this cholesterol test. It's very, even if you are not having all these symptoms that I mentioned, please do the cholesterol. Even once in a year, do cholesterol test. Yes, do it. It's very, very necessary. And the worst part of, if you are hypertensive or you are diabetic, it's a sure test for you. As you are running about checking your sugar level, your BP level, still check your cholesterol level as well. Thank you very much. I think my video is above 10 minutes. See you in my next video. And please don't forget to follow my page, Nurse Ng.O, and my YouTube page, Nurse Ng.O. Thank you very much for giving me your listening ear. I wish to see you in my next video.